It strikes in the dead of night when the world is quiet and your dreams turn into nightmares. But what if your worst nightmares could be your last? Every night, thousands close their eyes to sleep, not knowing if they'll ever open them again. They're unknowingly playing a lethal game of chance with the Filipino dream killer called
Bangungot, latest findings on the Filipino dream killer. The year was 1981. The LA Times have been running a series of articles about otherwise healthy refugees to the United States from Laos. They were found to have died mysteriously in their sleep, apparently experiencing violent nightmares. 38 such deaths were reported between July 1977 and October 1981. The CDC had linked these deaths to a condition we now know as sudden, unexpected nocturnal death syndrome or SUNDS. SUNDS is actually a condition endemic to Southeast Asia. This, known as Lai Tai in Thailand and Bokuri in Japan, this mysterious disease was first reported in the Philippine Medical Journal as early as 1917. Known in the Philippines as Bangungot, a combination of two Filipino words, bangon, which means to rise, and ungol, meaning to moan, it describes the terrifying nightmares people seem to have right before dying in their sleep. These deaths were so startling that Bangungot or SUNDS may have been the inspiration to the hit movie series A Nightmare on Elm Street. Film director, screenwriter, producer, and actor Wesley Craven admitted that he got the inspiration for the character of Freddy Krueger from the LA Times article about deaths caused by nightmares. Good morning, good afternoon, and good evening. This is Dr. Hanz Bustamante welcoming you to my YouTube channel, Dr. Hanz MD. And I want to give out a special shout out to my subscribers in the Philippines. Kamusta po kayo? If you have not done so, please like, subscribe, and click on the bell icon so you can get the latest medical knowledge explained plain and simple. Today, we will be talking about SUNDS or Bangungot. We will explore the latest research about Bangungot's possible causes, demographics, and ways to prevent this dreaded disease. Bangungot has often been associated with bleeding in the pancreas. This was thought to be brought on by eating a large meal right before sleeping. But a report published by Oxford University in the Journal of Human Molecular Genetics have strongly suggested that Bangungot is closely related to an inherited heart condition called Brugada syndrome. Incidentally, Brugada syndrome is also common in Filipinos. Brugada syndrome makes you more likely to have sudden cardiac death, especially after a high carbohydrate meal and heavy alcohol use. Majority of sufferers are otherwise healthy males between 20 and 40 years old. They are of Southeast Asian descent who ate a large meal right before sleeping. Having a first-degree relative who died in their sleep can also be a risk factor. As scary as this disease may seem, there are ways to minimize your risk of this disease. Number 1, schedule a visit with your primary care doctor and get a comprehensive annual checkup. Ask your doctor for a baseline EKG or electrocardiogram to rule out Brugada syndrome. This is especially true if you have a first-degree relative affected by SUNDS, as you may need some genetic testing. Number 2, avoid heavy meals right before sleeping. The excess carbohydrates in your meal can cause electrolyte levels to drop and trigger an abnormal heart rhythm. Number 3, avoid alcohol. Heavy alcohol use can cause dehydration and alter your sodium, potassium, and magnesium levels. Number 4, walk it off. A 15-minute walk after dinner will improve your blood sugar levels while you sleep, making you less prone to complications. And lastly, if you have Brugada syndrome, Avoid prolonged exposure to fever, as this may trigger some heart abnormalities. You should take medications to reduce fever and consult with your doctor to find out the possible causes. You may also need additional genetic testing and heart exams. Very rarely, people may need an implantable cardiac device to prevent sudden cardiac death. There you have it. Thank you for letting me shed some light into the mysterious disease called Bangungot. This has been Dr. Hanz Bustamante saying, knowledge is power, so use it wisely.